welcome back to Medical Minute with Phil. I'm Phil. Today I have two experts here, John and Miriam. Say hello, guys.
How's it going?
Hey.
On today's show, we're going to be discussing Tamiflu and what you, the consumer, should know. So let's start with the basics. Tell me about the flu. What is the flu?
So the flu is simply a respiratory infection caused by several types of the influenza virus.
Well, all right. What about the symptoms? What are the symptoms of this flu?
Well, there are a range of symptoms associated with the flu. Some are similar to the common cold. Examples include fevers, chills, aches and pains, cough or sore throat, to more serious things such as pneumonia and secondary bacterial infections.
Oh my gosh, that sounds awful. So, what is this Tamiflu? Tell me about this Tamiflu.
Tamiflu is an antiviral medication. The way it works is by attacking the flu virus that's in your body and keeps it from multiplying. It can also be taken to prevent you from getting sick by taking it before you have the flu. For those times when your spouse or loved one gets the flu and brings it home.
Sounds great. Can anyone take Tamiflu?
Well, it can be taken by patients 2 weeks of age and older who have been diagnosed with the flu by a physician. It can also be taken by patients 1 year of age and older to help prevent that patient from getting the flu.
Well, that sounds great. So it sounds to me like you're saying I don't need to get the flu shot. I can just take some Tamiflu. Is that true?
No. The flu vaccine is still the best way to protect yourself from getting the flu and protect your loved ones from you exposing them to the flu. So you should still make sure you get one. You should try to avoid contact with someone who is sick to avoid getting sick, and it's also important to wash your hands regularly and cover your mouth with the inside of your arm when you cough or sneeze to prevent spreading the flu.
Man, that kind of stinks. Those flu shots hurt, you know what I mean? So what's the difference between treating and preventing the flu?
Well, treating your flu means you're taking Tamiflu because you have been diagnosed with the flu or taking a cold and cough type over-the-counter product to get rid of the symptoms that come with the flu. Preventing yourself from getting the flu means you are taking Tamiflu even though you do not have any symptoms to stop yourself from getting the flu.
So would I take them the same way? Would I take the Tamiflu the same way to prevent and to treat?
That's a good question, and actually the way you take it depends on if you're trying to prevent or treat the flu. How long you take it and how many times a day you take it will be different. Your healthcare provider will be able to give you specific instructions on how to take it.
All right, well, maybe you can help me out a little more. If I'm taking the Tamiflu and I notice that my flu isn't going away, or I start getting more flu symptoms like you described, what should I do? Should I go to the hospital?
Well, if you experience any new symptoms or find that your symptoms are not going away, you should contact your healthcare provider. It may be possible that you have another illness that looks like it's the flu, so you might need different medications to take care of the problem.
Oh, goodness. Well, what about like my grandma? She doesn't like to swallow pills. Does it come in liquid form?
Yeah, it comes in a liquid. It's available as a liquid if you prefer that over the capsules. The medication comes as a powder that should be mixed when you pick it up. So if you receive a bottle of powder, make sure to hand it back to the pharmacist to be properly mixed.
All right, it's good to know. So, you as pharmacist, is there anything, special that I should know about this medication?
Well, the pharmacist will give you points on how to use it when you go to pick it up. For example, if you get it as a suspension, they should tell you specific information like shaking the bottle before taking it, keeping it in your fridge, and they'll also let you know how long you should keep it before throwing it out and how to take it.
All right, I've been hearing a lot on the news, the MSNBC, that there's a shortage of the Tamiflu liquid. What would I do if I have trouble getting that for my grandma?
Well, if the suspension is not available, the pharmacy you go to should be able to make the suspension using the capsules instead. Further, if that's not an option, for some reason you really want to avoid swallowing the capsules, you can break open the capsule and mix the contents inside this with sweetened liquids such as regular or sugar-free chocolate syrup, corn syrup, caramel topping, or light brown sugar dissolved in water.
You pharmacists sure are smart. So tell me, what about my wife? She's pregnant. Is it safe for her to take Tamiflu?
Well, it's hard to generalize whether Tamiflu is safe for all women who are pregnant or nursing. This should be determined on a case-by-case basis with a visit to the doctor to discuss this. However, it is recommended by the U.S. Centers for Disease Control and Prevention that women who are pregnant and have the flu do get some kind of treatment to stop possible further and more severe illnesses from forming.
Well, I tell you, this medication here sounds great. But, there's always side effects. What are the side effects of Tamiflu?
Yeah, there are a couple side effects, and the most common side effects experienced are nausea and vomiting, but they generally aren't severe, and if they do happen, they happen within the first 2 days. So taking the medication with food will help those side effects, Some other side effects could include stomach pain, nosebleeds, headaches, and possibly feeling a little bit tired.
Yeah, I tell you, that doesn't sound so bad. Is there any side effects maybe that are a little worse that I should also know about?
Yeah, there are actually some more severe side effects of Tamiflu. Kids and teenagers who have the flu might have a bigger risk of seizures, experience abnormal behavior, or confusion. This can be caused right after starting Tamiflu, so it's important to keep in mind that while these side effects may occur, it is not very common. You should look out for any unusual behavior while on Tamiflu and go to the doctor right away if this does happen.
Ah, geez. All right, that's good to know. So now to get to the burning question here. How beneficial is Tamiflu?
Well, on average, Tamiflu has been shown to reduce the time someone has major flu-like symptoms by 25%, so about 1 day. Studies have shown that Tamiflu can shorten the time of illness by up to 2 days if you start it within 24 hours of symptoms. It has been shown that it can help to minimize fever, chills, cough, body pain, and headache, but it will not help with the GI problems: nasal congestion, sneezing, watery eyes, fatigue, sore throat, or runny nose. Taking Tamiflu to help prevent the flu after exposure is about 70 to 90% effective, with the best results occurring if started as soon as possible and within 48 hours of exposure before showing symptoms of the flu. It's now recommended to take Tamiflu if exposed occurred more than 48 hours. In an attempt to limit the antiviral resistance, widespread and routine use of Tamiflu for influenza is discouraged, but the annual flu vaccine remains the gold standard for flu prevention.
I tell you, you guys, you sure are smart. You know what you're talking about. So let's break it down out there for the internet audience. What do you think of all this information?
Well, it's difficult to have an absolute answer to this question because of all of the information that's out there, but I suppose that in some cases, shortening the length of time that you're stuck suffering with the flu by using Tamiflu is worth it. And if you do bring home the flu into your house, it's nice to know that your family can take something that may keep them from getting sick too. I mean, personally, I'm definitely going to get my yearly flu shot though, and make sure my family gets the flu shot too. If I can avoid suffering through the flu with a yearly flu shot, then I'm game.
All right, guys. Well, thank you very much for your time. Thanks for coming to the Medical Minute. I'm Phil. I'll see you next time.
Thank you.
Thanks, Phil.